Namaste, my dear friends. Now referring to you, health sector exemptions granted to health sector under the GST. Referring one by one is as follows, my dear friends. Healthcare industry, if you refer, is to cover hospitals. It may be private hospitals. It may be nursing home. It may be government hospitals. It might be multi-specialty hospital, as the case may be, which cover under the exemptions category, being a clinical establishment. Hospitals comes under the category of clinical establishment. Further, pharmaceutical sector, without which healthcare services not possible to provide, followed by medical practitioners. Authorized medical practitioners are very important, who are qualified medical practitioners, allopathy, homeopathy, Unani, Siddha, and so on. Authorized medical practitioners. Combination of these three, healthcare sector. Qualify for exemption in what extent, in what circumstances, is now I am going to refer under the GST. Exemptions granted to healthcare sector consist of hospitals, pharmaceuticals, followed by authorized medical practitioners. All the three combination. Referring here one by one. If you refer, my dear sir, GST exemption granted to the healthcare sector in the case where recognized system of medicine, if you provide these services, recognized system of medicine, what are they? Allopathy, English medicine, yoga, naturopathy, Ayurveda, homeopathy, Siddha, Unani. These all are supply of services which will qualify for exemption, absolutely exempted, if they are provided being a nursing home or an hospital, where it may be multi-specialty hospital, it may be private nursing home, as the case may be, as long as these and all the recognized system of medicine under the Indian Medical Establishment Act. Resultantly, their services absolutely free from GST. I mentioned here hospital. I too mentioned here the authorized medical practitioner. For example, I am Mr. Rafi, MD, heart surgeon, Dr. Rafi, for example. I am an authorized medical practitioner. I am a visiting doctor in particular multi-specialty hospital, say Kamakshi Memorial Trust Hospital, where I am a visiting doctor. I used to visit only on Sundays, morning 9 a.m. to 1 p.m. I used to attend the Kamakshi Memorial Hospital, being authorized medical practitioner to treat the to provide the healthcare services to the patients. Now here, Kamakshi Memorial Trust Hospital collecting the fees from patients, let us say 1 lakh rupee fees collected. Out of the 1 lakh fees, 75,000 fees paid by the Kamakshi Memorial Hospital to visiting doctor, to Mr. Dr. Rafi. So Dr. Rafi provides the services to patients who are attending in the Kamakshi Hospital. Kamakshi Hospital collecting the fees from the patient 1 lakh rupee, retaining 25,000 with them, balance 75,000 paying to the doctor, who is authorized medical practitioner, Dr. Rafi. Now, Dr. Rafi services, being authorized medical practitioner under the allopathy and recognized system of medicine, absolutely qualify from exemption. With regard to services supplied by the Kamakshi Memorial Hospital to patients by charging 1 lakh rupee, also be exempted. That means collecting 1 lakh rupee from the patient is exempted under the category of healthcare services in the hands of the hospital. Out of the 1 lakh, they paid to visiting doctor 75,000. That 75,000 in the hands of the visiting doctor also be exempted from the payment of GST. As a whole, the hospitals, nursing homes, multi-specialty hospitals, private hospitals, government hospitals, whatnot, if they charge the charges by providing healthcare services in the recognized system of medicines like allopathy, yoga, naturopathy, Ayurveda, homeopathy, Siddha, Unani only qualify from exemption. Other than this recognized system of medicine, if they provide these services, attract the GST. For example, pranic healing services. For example, pranic healing services offered by Kamakshi Memorial Hospital to patients by charging the charges will attract the GST. Acupuncture, acupressure treatment, Reiki therapy, color therapy, these are all not recognized system of medicine in India, resulting that those services offered by the hospitals or nursing staff will absolutely attract the GST. Supporting services to recognized system of medicines like the scanning, blood test, urine test, this type of services, followed by ambulance services, nursing staff services, physiotherapist services also qualify exemption. Nursing staff services, physiotherapist services, technician services, lab assistant services, ambulance services, diagnostic services, all are qualify for exemption. These are all supporting services to a recognized system of medicine. Further, qualify from exemption services provided by rehabilitation professional services. You are aware of that rehabilitation professional services, which I refer to you by inviting the attention on the part of the charitable sector. A charitable entity registered in section 12A or 12AB of the Income Tax Act provide the services of rehabilitation professional services which will qualify from exemption. I already referred to you that, again repeating here because it is healthcare services without which we cannot be able to conclude the healthcare services. Therefore, I invited the professional rehabilitation services offered by government, central, state or charitable institutions registered in section 12A or 12AB of the Income Tax Act at the premises of the hospital or education institutions or any rehabilitation centers qualify from exemption. Referring here, services provided by rehabilitation professional services at medical establishments or at educational institutions or at rehabilitation centers, services offered by central government, state government or charitable entity registered in section 12A or 12AB of the Income Tax Act absolutely qualify from exemption under the healthcare services. Further referring, my dear friends, from here, when you refer what is not exempted from the payment of the GST, GST exemption not available to healthcare industry. What services? Now recently there are some exemptions has been withdrawn also, which I am presenting here, very important, one can expect in the examination. Referring here, cord blood bank services, cord blood bank services, which is almost all cities across the India, all hospitals are offering, even small nursing homes also offering cord blood bank services where the mother is blessed with the baby is coming out from the mother womb with a particular nerve, main nerve, and doctors scissoring it and detaching the baby from the mother womb. In that case, from that mother womb, when the baby detached from the mother nerve, main nerve, which was attached to the baby, now detached from that mother nerve, extracting relevant quantum of requisite quantum of the blood to preserve the stem cells in a cord blood bank. For that services of preserving the stem cells, the cord blood bank charging the charges, that charges now is taxable. No exemption. Exemption has been withdrawn from this particular for the given service. What is the use of the particular stem cells preserving in the cord blood bank? If tomorrow, day after tomorrow, over a period of time, if the mother or the baby required, or if you met any accident or maybe fell into illness, this particular stem cells which is preserved in the cord blood bank is going to helpful to cure more than 90 diseases. That's why nowadays very often everyone availing these services. Thereby the government decided to tax it. Exemption has been withdrawn for this. Now taxable. Further, services offered. What type of services? Pranic healing services, acupressure services, acupuncture services, Reiki treatment services, color therapy services. Different colors are throwing on the body to eradicate the pain or the disease over a period of time. Maybe recognized system of medicines in other countries, not in our India. Resultantly, it is taxable. Further, my dear friends, hair transplant or cosmetic or plastic surgery services. Hair transplant for beautification of the face. Hair transplant, growing the hairs. I am undergoing the treatment to grow my hairs. I paid 1 lakh rupee every month. Each month, one hair is coming. Thereby, so much of a hairs grown over a period of time. In that case, my beautification of the face purpose, this expenditure has been incurred, and the nursing home or hospital medical authorized medical practitioner who provide these services absolutely taxable unless it is a warranted. What do you mean warranted? I am the person fighting with the fire, saved certain children's life, thereby my face partly here got gutted with the fire, thereby damaged. The jaw has been damaged, skin has been fully damaged. Therefore, I am undergoing treatment of plastic surgery, which is warranted. Such as services are still exempted under the healthcare services. Further, my dear friends, the common biomedical waste treatment services. Undoubtedly, hospitals are curing the diseases, healing the diseases, provided hospital waste, if it is going to be properly disposed of. If the hospital producing the waste, cotton with the blood, used syringes, tablets, expired medicine, this and all, if not properly disposed of, hospitals not going to cure the diseases, going to cause the diseases. But what we can do? There is a biomedical waste management service course is there. I undergone that course, for example, and I am providing services of cleaning the waste from the hospitals. Day to day, I am coming with my truck and cleaning that particular waste and disposing of in a proper manner. Some of the waste buried, some of the waste is burned, some of the waste is mixing with the sea in the sea, or like that I am disposing of without causing any what we call environmental effect. In that case, my services are merely humble services which I am providing to hospitals. But the law of the land here said, sorry, your services are not, no longer is exempted. Exemption in the recent past has been withdrawn. Biomedical waste management services offered by a biomedical waste management service provider to clinical establishment by cleaning the waste of the hospital, no longer exemption is now given. It is now taxable for our coming exam of May 24 or June 24 examination, as the case may be. It has been taxed even in the last exam of November 23 itself. So it is now taxable services. Case study type of applications under the healthcare services. Exempted irrespective of room charges for those patients who are admitted in the hospital, especially in the ICU, intensive care unit, critical care unit, intensive cardiac care unit, or neonatal intensive care unit. It may be ICU, CCU, or ICCU or NICU, as the case may be. If the room charges per day 1 lakh rupee, for example, ICU 1 lakh rupee per day, I have paid practically when my father was admitted in Apollo Hospital ICU. They said, sir, per day, it is 24 hours, 1 lakh rupee. For 3 days, you have to pay in advance. Immediately, we use our payment and made the payment of 3 lakh rupees deposited for 3 days. Per day 1 lakh rupee. 1 lakh rupee room charges. Room charges includes maybe the medicine, doctor fees, that ends, whatever maybe. This is room charges. If the room charge is 1 lakh rupee, taxable or exempted? Exempted because the patient is admitted in ICU, intensive care unit, or the CCU or ICCU or otherwise NICU. Room charges, whatever charging, even 1 lakh charging, only for room charges. Doctor will leave it. Room charge only per the patient, not per room also, per patient, per day. Whatever may be the value charge, the hospital is free from GST. Further, what about room charges, not ICU? Normal. Room charges are what we can call as the patient per day charges instead of what we can call it separate room may be there or general ward may be there, as the case may be. GST exemption is available if the room charges per day less than or equal to rupees 5,000. Only room charges less than or equal to 5,000. That means GST exempted on room charges less than or equal to 500 per day to a person receiving healthcare services. It may be general ward, it may be separate room, as the case may be, as long as the room charges less than or equal to rupees 5,000 exempted from a patient per day. Sir, for a patient per day more than rupees 5,000, sir, let's say they're charging 7,500 per month per day, sir. 7,500 per day. 7,500 per day. Room charges per patient taxable, which is not ICU nature. Therefore, what value taxable? Entire value of 7,500 per room per day charges per patient 7,500 charging as a room charges per day basis. Entire 7,500 taxable. Not that over and above 5,000 is taxable. It is not so. Entire 7,500 is taxable if the hospital charging from inpatient by providing room services more than rupees 5,000, the entire value taxable. If they charge 7,500, entire 7,500 taxable. What rate applicable? No, 5% of GST, no input tax kit to them, to the hospital. Further, my dear sir, nowadays we are injected by the healthcare institutions corona vaccine, flu vaccine, that vaccine, this vaccine, booster, that and all. These are the services which are preventive care services, which is offered by the hospitals, nursing homes, medical establishments, clinical establishment provide these services, or a authorized medical practitioner provide these services. Preventive care services absolutely qualify from exemption. The GST exemption on preventive care services has encouraged patients to adopt healthy lifestyle and focus on preventive health care, resultantly to avoid a number of type of diseases. So these are all the points merit from the exam point of view. Therefore, I taken as a case study oriented examples. Furthermore, my dear friends, here IVF, like in vitro fertilization, or ART, namely assisted reproductive technology services. What type of service basically it is talks about? I mentioned here point number 1, point number 2, like that. I mentioned up to point number 7. I mentioned for information. In vitro fertilization. Nowadays, it became so fashionable, especially among the celebrities, especially. Let us say Mr. X, Bollywood actor, married with particular Bollywood actress. Let us say Mr. X, Mrs. X. What we eminent actors, celebrities, and Mrs. X has so many movies to act as a heroine. After they got married, if Mrs. X consumed and blessing with the babies, then what happened? There may be a possibility of her particular personality may deviate. Resultantly, they are not consuming themselves, but they are getting the child. How you know, my dear friends? Mr. X, eminent Bollywood actor, Mrs. X, also eminent Bollywood actress, both of them is undergoing an agreement with a third person, yeah, a particular third woman. That third woman, third party is going to consume baby for them. How it is possible? With the help of the doctor's observation, medication, with this well possible. Taking the sperm of Mr. X and Mrs. X and is inserting with a third party particular womb. Thereby what happened? The third party is carrying, consuming and carrying the baby of the particular immune persons. And at the end of the particular 9 months period, the third party delivering the baby and the baby is handing over to these eminent personalities. So Mr. X, Mrs. X blessed with the baby, where they have hired a particular third party to do so. This and all activity takes place only with the supervision, observation, strict monetization of the authorized medical practitioner under a particular hospital or otherwise a nursing home, without which it is not possible. So such activities offered by the hospitals, nursing staff or otherwise authorized medical practitioners, none other than healthcare service only. Clarification given by the CBSE. Resultantly, services in the form of assisted reproductive technology ART or in vitro fertilization IVF exempted from the payment of the GST in the hands of the authorized medical practitioners, in the hands of the nursing home or hospital, as the case may be. Assume a scenario. Mr. X, who is a patient, got admitted in the hospital. Doctor said, "Hey, Mister, for you, heart so weak, need to have heart surgery. Otherwise, you may die. Therefore, strictly instructing you, admit in the hospital, join as inpatient. We will observe and monitor you for a period of 1 week. After that, we will go for surgery." That patient got admitted. For 5 days, doctor prescribed what type of food to provide. Canteen wala in the hospital provided canteen services as per the specifications of the doctor. Morning, only 2 idlis with sugar. Afternoon, 100 grams of brown rice with saltless dal. Evening, 1 chapati without any oil. That's it. In between, cup of milk will be given. Like that, prescription has been given by doctor. Over a period of 5 days, the catering wala provide the catering services as per the prescription of the doctor. And during that particular 1 week period, medicine also be provided from pharmaceutical. There is a pharmaceutical provisions are available in the hospital. The shop wala is providing as per the prescription of the doctor medicine, tablets, tonics and all. On the day of surgery, hospital provided to the patient the operation theater where the doctors, nursing staff provide the operation and consumed various types of pharmaceutical medicines. Operation successfully completed. Now patient, after operation is completed, 1 or 2 days, he is very good, well and smiling, speaking with the relatives. Bill came from the hospital. Doctor fees 1 lakh rupee. Catering services 2 lakh rupees. Pharmaceutical supplied 5 lakh rupees. Doctor fees 1 lakh. 2 lakhs catering. 5 lakhs of pharmaceuticals, medicines. Totally 1 plus 2 plus 5. Almost all 8 lakhs. Thereafter, operation theatre charges 1 lakh. Room services 1 lakh. Total round figure 10 lakh came bill. It consists of doctor fees exempted. Aware of that. Room charges taxable because more than 5,000. Not ICU it is. Further, the catering services taxable 2 lakh rupees. Medicine, taxable, which is 5 lakh rupees. Hospital charges, all put together came 10 lakh rupees. Now, entire 10 lakhs is exempted, or identifying doctor fees exempted. The hospital charges, hospital nursing staff charges exempted. Balance, catering services taxable. Like that, you tax it, few of it, or you exempt whole of it. That point comes into picture. We have a clarification from the CBIC. CBIC said, it is what type of services? Basically, two or more services, composite services. One cannot able to provide services isolately. Only I will provide the operation, no medicine. Possible? Operation success? No. Sir, without giving the food, medication properly, food under the supervision of a doctor, operation not possible. Therefore, catering services is essential to provide for completion of the healthcare services. As a result, CBIC said it is a composite services. In that, what is the principal element of service? Predominant element of service is a principal service. Predominant element of service is healthcare services. Resultantly, that predominant element is healthcare services, which is exempted supply of services. Resultantly, the whole 10 lakh rupees charged in the given case qualify from exemption. Got the clarity, my dear friends? Is the way in which clarification given by the CBIC in this regard. Suppose outpatient, a patient came to hospital evening 4 p.m. to consult with the doctor. Doctor tested, okay, you are good health, no problem. Take these medicines further. Like that, doctor charges the fees, 500 rupees. And he want to buy the medicine in the same pharmaceutical shop available in the hospital. He given that particular script, the particular slip of the doctor. Then the medicine has been purchased. Pharmaceutical shop sold the medicine. There are two events. For sale of medicine, they charge rupees 2000. Doctor fees 500. These two are supplied to outpatient. What is taxable? What is exempted? Separate supply of services. Doctor fees falls under the exemption category. Authorized medical practitioner 500 exempted. The pharmaceutical wala sold the medicine for rupees 200 to outpatient, which is not form part of the healthcare services as we understood earlier for inpatient. Therefore, it is outpatient. Here, the pharmaceutical wala supply the medicine to that particular outpatient, attract the GST as per the rate prescribed for the medicine. Got the clarity, my dear friends? Hopefully, I have covered almost all the points in this regard. But one client come across to me by asking, sir, department send a notice to me. I am providing ambulance services, sir, and they asked me to pay the GST, sir. I said, ambulance service if you provide, absolutely free from GST, sir. Why the department will ask you to pay the GST? Yes, sir. See that, sir. Department harassing me, sir. Like that, he started to say. Then I asked, what type of nature of service you provide? Exactly tell me. He said, sir, I have ambulances, 5 ambulances. I have with me, sir, all the 5 ambulances I given in hire basis to Kaveri Hospital, sir. You given hire basis. That means you are not running the ambulance services. I am not running the ambulance services, sir. My ambulance services, I given hire basis. Monthly I am getting so much amount, sir. Per vehicle I am getting 1 lakh rupees, 5 lakh rupees I am getting, sir. Sir, in that case, your services not come under the ambulance services. You are providing hiring of passenger vehicle services, sir. Hiring of passenger vehicle, absolutely at the GST, no, sir. You have to pay GST, no. So, hiring of ambulance services is different from carrying the ambulance services. Therefore, hiring of ambulance services, at the GST. Department correct to levy the GST.